Can
Mhm.
you briefly just talk about like who you are, kind of how you came up with your training? I know that you went to the University of Florida. I won't hold that against you. I went to the University of Georgia. Um, but if you can talk about just your training a little bit and kind of how you got started with behavior, and then we'll transition to talking about specific things that we're going to talk about. Let's just say
Yeah, so I'm a board certified vet behaviorist. That's a vet psychiatrist. A lot of people don't know that I even exist or people like me exist. I
that. Have
did
you?
go,
So you use that term, vet psychiatrist?
I do, but
Okay.
everyone in the college doesn't like that. So for
Okay.
people, so
Okay.
parents listening, when we say the college, I mean the College of Behavior, right? Which
Right.
is not a brick and mortar college. It's basically an organization that certifies people like me. There's a neurology, there's a everything college, right?
Right.
So not everybody in the college likes that. And I think there's always going to be differences in opinion. Look, there's differences in opinion as to what we should call people that have pets. Are they owners? Are they pet parents? Are they guardians?
Yeah.
So there's always going to be a difference. I use psychiatrists for a couple of reasons because I think it best describes what I do. I'm a doctor, right? So I examine the medicine. I use medicines to help patients. I examine the physiology of the patient, the whole thing, right? And Rick Lakuter, who you probably know who that is,
Yeah.
he's a neurologist, OG. And when I first met him, he was already near retirement. And he said to me, and I think it gave me validity too. He said, and I say that for those people that aren't in vet med because behavior is sort of like sometimes regarded as opinion. And I'm always like, no, it's science. And we have all of these studies, to show all of these things. So he said to me, I operate at the, speaking of himself, and hopefully I don't mutilate this, that he examines the anatomy, the neuron, and the electricity, right, to the brain, and that I work on the muck around that. So
Okay.
neurochemistry.
Yeah.
So I'm not so much the anatomy, I'm more like the neurochemistry.
Yeah. I
So
mean, it's very
yeah,
similar to psychiatry versus neurosurgery. It's like, the
yeah,
the mind versus the body, I guess, if you want to call it something like that.
sure.
Right.
Yeah, yeah,
Yeah.
yeah. So I went to U of F and then I went to Penn for my residency. And the reason I came to behavior, when I went to vet school, I knew I wasn't primary care material. I knew that was not for me. It was either neuro, derm, or behavior. I can't do surgery. So there's no way I could have ever been a neurologist, even
Yeah.
though it's very exciting to me. I love derm, but I thought that the thing that really made me get excited that I could do until I was 80 was behavior because I never tire of it. And I
Yeah.
feel like, and I don't know how you feel about neuro, maybe you feel the same, but I feel like I get up in the morning and I put on my cape and I go out, right? And I really want to educate every person I meet on the behavior of their pets and how their relationship with their pets affects behavior. So it was a
Yeah.
good choice for me because I'm 23 years out of school.
Yeah. I
So,
can I can definitely relate to that. I feel with the cape analogy, I feel a responsibility to provide uh, resolution of pain and improving mobility with pets. And that's I think those are the two biggest factors with quality of life with anything, people or pets. And I feel neuro has a unique capability to provide that. So that's my mission statement version of that.
yeah.
So you currently work in Florida. You are the owner, I believe, of Florida Veterinary Behavior Specialists.
Yeah, behavior
Um,
service. We
behavior
could have come
service. I'm
up
sorry.
with a different name. We really needed a different name, but
Okay. Okay.
too
But
late.
you're stuck with it, stuck with what you got.
Right.
Um, so I could go down an entire rabbit hole of like what it's like owning a private practice, but I don't want to consume all of our, time doing everything today. So if you can talk about what you see and the types of cases and your day-to-day caseload and like what they are and who refers you what, if you can summarize that, that would be good. I think that would be good info for people.
Well, so most of our referrals, I think, like most specialists, come from veterinarians. We do allow people, and we permit self-referral. People always ask that, I think, because in human medicine, sometimes you can't self-refer. But of course,
Right.
you can self-refer to most veterinary specialists, definitely to us.
Most.
And yeah,
Yeah.
yeah, the most common cases that we see are similar to what you'll see in studies and all over the world for vet behaviorists, and that's aggression. Aggression, though, is like vomiting. it's a non-specific clinical sign. So
Right.
there's all the differential diagnoses for aggression and all of these different situations. But that's the thing we see absolutely, I would say, most frequently.
Okay. And in our discussions, in kind of planning this, you had mentioned talking about a specific condition that I think warrants definite discussion. I've been thinking about even just making a video about this myself, but because I only see this condition maybe like, honestly, I've probably seen it 4 or 5 times in my 8-year career as a neurologist. Like,
Yeah.
it's handled by behaviorists and even primary care doctors more than me. So in making that video, I was like, oh man, you need to talk to somebody else about this because I just don't have the experience here. And that is feline hyperesthesia syndrome. And that is a very common overall condition, but also very difficult in all forms: diagnosis, treatment, recognition, condition in cats. And we're going to talk about that mainly on this episode or this video today. So, in getting to that discussion, my first question to you, if you can summarize we'll start with what is feline hyperesthesia syndrome, and then we'll go through what it looks like and diagnosis and treatment after that.
Yeah. What is feline hyperesthesia syndrome? I don't know.
Yeah.
Nobody knows. That's really the answer, is no
Yeah.
one knows. So I would relate it to where maybe, and hopefully this is not offensive to anyone, but to where fibromyalgia was 10 years ago. If
Okay.
you're in pain and we don't know what it is, it's probably this. And when you look at textbooks and look at the description, so our textbook just came out in May of this year, and you look at the description of feline hyperesthesia, it's this long description of clinical signs that could be related to anything: tail thrashing, self-directed aggression, hissing, trying to escape, skin rippling. And we say that, oh, that's the hallmark sign. But is it? Because I think we're using hyperesthesia just to cover all of our bases. And so when people bring those cats to me, and I, like you, I don't see them very often.
Okay.
And people should know we don't have a lot of studies on feline hyperesthesia. There are some, but they're usually case series,
Right.
and sometimes they're retrospective. So we don't have a really good, like, okay, what are the diagnostic criteria for this thing that we are calling feline hyperesthesia? So when people do bring them to me, and the reason I wanted to talk to you about it is we had a follower from our Instagram account say, what is this thing? My vet doesn't know what it is,
Right.
right? So it is a group of clinical signs that have to do with high arousal in cats that usually involves all the things that look like arousal: tail thumping, skin rippling, hissing. They may bite another cat or a person. They may bite themselves. Sometimes they turn back and they look kind of shocked
Yeah.
by what's happening, right? And the first thing I always do, 100% of the time, I would say 99.9% of the time, is work them up for derm.
Okay. Because the kind of the clinical sign that most people know about is rippling skin, I feel
Yeah.
like. And I'm going to share my screen just so you can I got a video. Let's see. We can edit this to make it quicker. But this is from a vet clinics chapter written by Claire Rusbridge. And what we're talking about when we say rippling skin and these sorts of odd, irritable behaviors that cats have, it's like as simple and mild as this. I mean, this is straight out of the research paper, and I'd be willing to bet 8 out of 10 people who own cats would just look at this and be like, oh yeah, I don't even notice it. So when people bring these cases to you and they show you videos or describe this and it's that mild, it's really difficult to know, like, is this even a problem? Like, the first question you have to ask yourself is, are we dealing with a neurologic or any other problem when we see
Right.
these patients? So it's really tough to even recognize. And what we've kind of figured out so far is, like you said, it's a mixture. There's definitely like an emotional component to it in cats, because cats will display a combination of like probable pain, but also it's this like anger, irritability that they have, and that leads to them kind of attacking back there while rippling at the same time. And when you see cats who are currently, angry or aroused, like worked up about something, they will do that same thing, but it's not feline hyperesthesia syndrome per se.
Yeah.
And so the kind of the worry here is that with feline hyperesthesia syndrome, it leads to like self mutilation. It is kind of like the end stage of it, where they start to just attack themselves, and it's this never ending like self-attacking injury, um and it's just kind of like stops, and then that sort of like snowballs into itself, and it becomes this cycle of like, well, now I'm hurting because I hurt myself, and now I'm angry because of that, and it's just this cycle that you can't get on top of, and you've got a cat that just spirals out of control, and it's really hard to watch. um I think the biggest thing I wanted to kind of talk about from the neuro side was that if you're dealing with a painful cat, you're dealing with a cat, if their skin is rippling and they're attacking that kind of tail base region of their back, from a neuro perspective, we're talking about things in the spine that generally would cause back pain that can mimic that. And those things in cats would be things like spinal tumors and disc herniations and infections and meningitis, malformations of the spine, things of that nature. So that gets into the diagnostic kind of algorithm, which is, like you said, the most common thing to look for first is their skin. And you as a behaviorist, how do you immediately, if you see a case presented this way, do you immediately shift to saying, okay, you need to see a dermatologist first, or how do you approach like the the initial sorts of workup that you get?
Yeah, and much like you and dermatologists and other specialists, and I try to collect enough history to know something about the environment as well. Did this coincide with a certain event or a change in lifestyle or moving house or whatever? But one of the first things I would say, or the first thing I do in almost all cases, is start to work up for derm. So I'm not a dermatologist, and I like to stay in my own lane. So I will always
Same.
do, yeah. Oh, yeah. Revolution Plus immediately. Sometimes I will do a prednisolone trial to see if that alters the behavior at all. And what I try to tell clients is that this may have components of neuro, ortho, derm, and psychiatry. You
Yeah.
may be that lucky to have a cat that has four things going on. So we're going to do one thing at a time. And if any of these things, if Revolution Plus by itself, if prednisolone by itself alters the behavior at all, a percentage change, then off you go to the neurologist, bye-bye, right?
Right.
And so
Right.
that, or the dermatologist rather. So we're going to
Right.
start that way. And often I will still refer them to the derm, even if we don't see a difference with those two things, because what I'm learning just from my friends like Dr. Rosales, so she's got Itchy Pet on Instagram, right, is
Okay.
that so much of what we as non-derm specialists think is appropriate as far as a trial of med or whatever is not appropriate, which
Right.
makes sense because I'm sure you're experiencing that, and I experienced that as a veterinary behaviorist. So I do often still refer to derm, but I try to help in that moment to alleviate the pain and suffering of the animal,
Right.
right? In whatever way that I can. And when you open up your textbooks and look at the case series, gabapentin is listed. Gabapentin is commonly used in cats. We use it in cats. However, we're using pregabalin a lot more now than we used to. So I don't know if the case series that come out in 5 or 10 years will be talking about pregabalin for these kitties instead of gabapentin. So I
Mhm.
try to alleviate clinical signs to make the cat feel better. And I just want to say one thing about pain, because I know that that's one of your like foundational values is alleviating pain in
Yeah.
animals, is that in human beings, pain is perception, right? Like, I had just had surgery 3 weeks ago. My sister said, you have a high pain tolerance. I'm like, I don't know that I do, but pain is partly perception. And then, so if you perceive pain a certain way, and maybe it's really uncomfortable, and you perceive that a certain thing that you might do, move a certain way, step a certain way. We see this all the time. If you have an older parent, like my mom's getting older, right? If you perceive that if you step in a certain way or do a certain thing, you will be painful, that can cause you to have anxiety about doing the thing.
Right.
So we don't know with these cats if they were aroused first, if they were painful first, if they were itchy first. And itchy is pain. Let's not sugarcoat it. When
Just
you're
a
itchy, it
right
hurts.
form
Yeah.
of it.
Yeah.
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 And I wanted to share, so I pulled up the vet clinics chapter as well, just because you mentioned the treatments available. Harrison, you can make this faster. Here we go. but I think we got the treatments right there. And you mentioned these are a combination of pain medication, sedatives, uh, seizure medication. So generally, what we're looking at is, I think you kind of touched on this too. Not only just the drugs, the response to the drug that you try, leading to what specialist to then go to, but also like this is all just like a drug trial sort of scenario at the end of the day. I mean, unless you identify an underlying either clinical sign or diagnostic finding that gives you a clue that, okay, this is actually something else that's causing pain in the cat. If you're treating feline hyperesthesia syndrome, where this is like a similar list of things that you would go down, you would just go down this list, try things like you mentioned, steroids too, on top of this.
Yeah. So I
Um,
think, though, I want to leave this up for a second because I want to ask you a question,
okay.
because I look at this list, and some of this list, in my mind, is outdated. I don't know how old this vet clinics chapter is, and I have no problem disagreeing with other
Yeah,
specialists
yeah,
about
yeah.
specialty, right? I
Well,
won't say about neuro, but is this an old chapter? How many?
well, it's not specific to feline
2020.
hyperesthesia
That's
syndrome.
not old.
No. So, but what it is it's a vet clinic chapter about neurobehavioral disorders,
Ah,
and this is more or less just in general. Where did I find the medications there? It's on page 12. So this is more or less just a medical management of maladaptive pain in the
got
cat.
it.
So
Got it.
it's not for feline hyperesthesia specifically, but many of these drugs you would be using as a drug trial
Yeah.
in the cat.
So what I
And
want people to know with this chart in mind, what I would like them to know is a couple of things. Number one, this chart to me is more fuel on go to a specialist, because I don't think you or I can't speak for you, but I don't think how I know you, that you would just go down the line here. And I don't
no,
want
no, no, no.
right, right. I don't
I
want
did not mean
veterinary.
to insinuate that.
No, no, and I
Yeah,
wouldn't either. And there's some drugs here I just wouldn't use as a veterinary behaviorist because I know they don't work very well, like amitriptyline. I mean,
yeah,
we literally don't ever use it. I haven't
yeah.
used it in 20 years. So because it doesn't work well for anxiety, and I understand why it's here. It does have a little bit of pain relief, but it also has so many negative side effects, especially in cats: urinary retention, fecal retention, dry mouth sedation, and it's not good at relieving anxiety. So I want to make sure that pet parents know, yeah, this is a great chart, and I love some of these drugs, pregabalin, gabapentin, but we would want to go to a specialist. You go and see Dr. Salini, and he says to you, okay, we want to use phenobarb first, or maybe you want to use some other drug that I've never
Yeah.
heard of, right? That's why it's really important to not just run down the line and try drugs. And the other thing that I would say to pet parents and GPs is that when you go to a specialist, I know exactly how high to go with gabapentin. So we go up to 43 mg per kilo in cats of gabapentin because we have a study that shows at least for single dosing, we can go that high and it's safe.
Really?
So, yeah.
Wow.
So when you go to a specialist, remember, we talked another time about specialists and how when you're boarded, it's different than when you are when you're just trained and you haven't taken the boards. You have access to things that other people have done, right? That may not be shared with the general population. So I
Oh
think
yeah.
it's important to go to a specialist and also to get the diagnostics done that can be done within your means, so that you know what you're treating.
That's I know. God, we need to just make a video about just like the specialist versus professional interest sort of thing, because what you just said is so true, and I've never conceptualized it, which is you absorb clinical practices from other doctors along your training way. And I just thought of like a dozen different things that I do on my day-to-day practice that aren't published, just ways to treat things, ways to dose things, ways to recognize and talk to owners about that are not published. And you can't just find a table like this to just, dig it up and just go through it. So the nuance there is like definitely that was a very good topic. I would like to explore the future a little bit more. Um, all right, cool. So I will stop sharing this and get that down. Okay. Um, so I think that's a pretty good summary about feline hyperesthesia. I mean, is there anything else that we should Basically it's hard to recognize. It's a trial and error methodology based on what you think is, the things to try in the clinical signs and your judgment there. And it can mimic all sorts of other different pathologies, whether it be skin, neuromuscular, spinal, musculoskeletal, all these different things. And at the end of the day, it's frustrating, and sometimes it listens to no treatment whatsoever, and it gets worse no matter what you do. That's
Well, so what I would say is a couple of things. I agree with you with all those things. And I'd
yeah,
also add that don't sit on the problem. So it's so
yeah,
much to bring that problem to your primary care vet now and not sit on it and wait till it's a lot worse. Number two, if you're a cat pet parent, I don't know. I trust owners. I don't feel that. Sometimes I hear vets talking about pet parents and owners like there's this friction. It's them versus me. I don't feel that way.
yeah.
I feel like
Like,
most people know
oh,
their
she's
pet.
crazy.
Right. I hate
Yeah,
that.
yeah,
Absolutely hate that. Right.
yeah,
So what I would say is, your pet. If you go to your vet and say, there's a video of my cat, and my cat doesn't do that, and your vet says, oh, don't worry about it, then you need to go to a specialist or go to another vet or ask for a second opinion. And
yeah.
in veterinary medicine, we're not so used to second opinions, but I
Right,
was reminded by a friend of mine, because people who follow me on Instagram know that my dog is got transitional cell carcinoma, in his prostate, et cetera. So
yeah,
anyway, it's very, very common in human medicine. It's the norm to go to another specialist and get a second opinion. If you have
right,
cancer, it's totally normal to go to
right,
another onco,
right,
right? So I think it's perfectly acceptable for you as a pet parent to say, okay, Dr. Smith said this, whether Dr. Smith said your cat has feline hyperesthesia or Dr. Smith said there's nothing wrong with your cat.
right,
If you know there's something wrong, it's perfectly acceptable for you to go to another doctor and say, I'm just here for a second opinion.
right,
You may end up back at Dr. Smith's office. That's okay. That's all
right.
right.
No,
But
no party should be upset about this, vet or
right,
client. Nobody, because this is what we're trying to do. We're trying to like use everybody to try to figure out this problem here. You know,
yes, yes,
um, no, that's another great point. And I will say too, there's maybe some hesitancy from pet parents to do that, but there are barriers that some veterinarians and vet clinics have where it's like, yeah, I don't know if this needs to come to me, or we're just too busy and we can't, and it's just a month out and this isn't an emergency, or we're understaffed, and those are all real problems. But I think there are some solutions that need to be made for that to be made easier. you know I see a lot of frustrated people who are like, I'm trying to get in to see somebody, and like nobody calls me back, or I'm stuck in like a phone tree or something like that too, and that's obviously super frustrating. um yeah, those are all really good points. I wanted to maybe ask you, we didn't talk about this much on DM, but I literally came upon this yesterday, and that is apparently canine autism is a debatable thing. I wanted to laugh at this and just be super skeptical at first, but then I looked into it and I'm like, wait a second, like there's actually some discussions about if this is real or not. So I know I'm springing this on you because I didn't ask you this directly.
that's
Um,
okay.
and if you don't know, then we don't have we won't publish this part. But can you talk about like what this even is? I have no knowledge of this whatsoever, but
Yeah,
I think it's valuable.
yeah. So first, clients have been saying to me for many years, as I get older, it's hard for me to segment out how many years, but I want to say probably a decade. They've
Okay.
been sitting in my exam room and saying to me, do dogs get autism? Because my dog acts like this, right? So there's that part. There's the pet parent part of what they identify. And
Okay.
I'll talk a second about the pros and cons of that. Then there's also what we know. We don't have any research showing that dogs get truly autism in the same way that human beings get it. We do have these little bits in studies. So years ago, Nick Dodman, who is quite a famous veterinary behaviorist, double boarded anesthesia and behavior, ran the program at Tufts for many,
Wow.
many years.
Wow.
Yeah, he's pretty incredible dude. So
Yeah.
this is kind of in his mind because bull terriers were his like breed that he studied a lot. So he presented to us at a veterinary behavior symposium just some evidence looking at correlating dogs and the clinical signs we see in dogs as they might be similar to the signs of autism. He also started to talk about diet and dyes in the diet, which have been implicated in autism. I'm not an expert on autism, and people just put that out there. But
Right.
so there's talk, but there's nothing definitive. But here's the thing. Saying, is my dog autistic, can have pros and cons. The thing about that is the pet parents seeking, right? They're seeking an understanding and they're anthropomorphizing, which can be positive because then they have empathy.
Okay.
So if they have empathy for their pet, the door is wide open for us to get in there and say, okay, you understand what your pet is going through. Let's see how we can fix that, right? And that doesn't just apply to behavior. That applies to neurology. Like my dog had a TIA recently,
Yeah.
and I didn't know that much at all about TIAs. I have a wonderful neurologist here that I brought him to.
Yeah.
I learned that a lot of the TIAs are vestibular, in the vestibular region. I learned from him.
Yeah.
And then I noticed that when my dog went on his back, he panicked.
Yeah.
Right? And then I would call the neurologist, like, what is this? He's like, yeah, right, that can happen. Right.
Yeah.
Then I saw an opioid response where my dog got nystagmus. He was given opioids. So having that kind of looking at him on his back and seeing that his pupils were dilated and he was tense, having that empathy made me call Dr. Reed, like made me reach out to my doctor, right? So empathy is not a bad thing. I don't think anthropomorphizing is always a bad thing.
Okay.
It's when we take the next step and say, my dog is like my autistic nephew. I'm empathetic, that's good. If we take the next step and we go, so he must have the same executive function as my nephew. He must have the same emotions as my nephew.
Right.
Drawing those lines is detrimental because
Right.
we don't know that dogs have a process like autism. So I tell people there's no evidence your dog has autism, but I hear you and
Right.
I hear the signs you're describing, and those are really common with all these other disorders.
Right.
And I'm so happy that you care enough about your dog to have empathy for what your dog is going through.
Yeah. No, that's really good. So as far as the bull terriers go, what is it about them that they do or condition that they have specifically that that uh, is similar to autism? Like what is the problem with them?
Yeah, so I would have to review the presentation Nick gave us, but what I can tell you is MRIs of, well, you should tell me, MRIs, somewhere about this, of bull terrier brains show, at least the study that I've seen, the behavior studies, that their brains are not normally shaped, which I guess
Right.
is common sense. If your head's shaped like an egg, that your brain is not, normal.
Yeah.
But we see in bull terriers, as you know, because you see them probably as much as I do, spinning that is extraordinarily detrimental to the
Yeah.
pet's quality of life.
It's like it's a tail chasing syndrome.
Tail chasing, spinning, what are we going to call it? Like,
Yeah.
is it neurologic? Is it behavioral? Is it both? But these
Yeah.
dogs,
Yeah.
yeah, these dogs different than shepherds. Shepherds, at least, and I would love to hear your opinion because I think we're seeing the same cases. So shepherds spin to me in a different way than a bull terrier spins. They spin or tail chase, whatever we're going to call it. And bull terriers do it with such arousal, they just don't stop. Their feet are bloody, right? And so it's just a different level of intensity, I think. And we don't know. I don't know. I don't think researchers know if these things are the same or not. With shepherds, I always send them to the neuro. 100% of the time they go straight to neuro because of all the known spinal issues. So I would love to hear you talk about like that.
Well, for one, it would depend on what their exam shows. So if they have like LS or tail pain, like lumbosacral pain or some other like neurologic deficit or focal pain somewhere, then I would say, yeah, this needs to be worked up. A. If they don't, then I would say, well, we can still work it up and look at their spine with like an MRI and look for pathologies of some sort. But if there's no neuro exam finding or pain, then I would say to the owner, like, I'm just not sure if we're going to find something and we're not investigating an actual neurologic deficit here.
Yeah.
But in my experience, whenever I'm trying to figure out something and then maybe send it to a behaviorist, from what I've heard, behaviorists really like to have a normal MRI under their belt before they move forward.
Amen.
So I generally tell people, I'm like, even if I think this is probably going to be behavioral, if you're cool with doing an MRI, I would say we do it because the behaviorist is going to love this. It's kind of,
Yeah, because if I'm the final, if I'm the person that's in that final judgment chair of what to do, I want to know I'm 100% on the right track. And,
yeah,
what do you think? Because I'm one of those pet parents, I have insurance. So I would spend money on my dog anyway, but having insurance is like amazing, pet
sure.
insurance.
Yeah,
So I would be that person who would sit in your office with the German Shepherd, where if you offered the MR, I would 100% do it. So, like, how do you feel about people who want to do those diagnostics? Because I think the old way, or at least the way I was trained to think, was, what will it change what we do? And so when Maverick had the stroke, we didn't know it was a stroke yet. I knew immediately I wanted an MRI. I had one by that afternoon. Like, there was no question, because I thought he had a brain tumor, right?
right.
So sometimes maybe vets will say, or pet parents will say, well, what would we do differently? And to me, I'm like, knowledge is power.
Yes.
Knowing the dog doesn't have a brain tumor is a huge deal to me. So what do you think
Yeah.
about people who do diagnostics when you'd have a normal neuro exam? Like, what do you tell them?
I tell them that even if our findings are normal, that is a significant result. And if these clinical signs continue, we know that it is not due to any sort of structural pathology. And the prognosis, the treatment, and how you're going to feel about that is a lot different than if we found something. And even though it doesn't change the plan, it actually kind of does change the plan, because it changes like what you think about it and what you know and know is not happening. Like you have knowledge of what's not there. So I think it does change the plan, just not in a tangible, like, either way we didn't do brain surgery sort of a thing. But that doesn't mean that there's no value in doing this test either. So that's kind of how I navigate that. Back to the German Shepherd versus Bull Terrier circling versions. I think what you kind of touched on this. I think you can tell it's hard to write down and hard to objectively like make a grading scale of this sort of a thing. But you can tell as a clinician when something is kind of like a dog's losing their mind over, like more behavioral obsessive, versus when something's irritating them that they're trying to get to. And it's a very subtle thing, but if you observe it and you've been a vet for a number of years and seen these sorts of things, you kind of start to see the difference. And you see, like in the Bull Terrier example, I've only seen one case of this, by the way, in my career, but I did watch the dog do it in front of me. The dog just looked like he was like manic. Like it was like I have to do this obsessive. They call it this an OCD. They think,
Mhm.
um, and it looked exactly like what you would think OCD would look like in an animal, just completely just like, I'm trying to do this. Whereas a German Shepherd was like not necessarily having that appearance to their mentation and their behavior and their affect. Um, and they were kind of just like intermittently going at it, like, hey, something's like jolting me, but that's it. It wasn't like continuing to go after it. So I think there's some real subtle nuance there that you need a few cases and reps to kind of know the difference of. But it's also hard to like, it's kind of a gut feeling thing that you develop over the course of your career, you know?
It is a gut feeling. It's like, it's hard to teach. It's
Yeah.
hard to teach. Yeah, sometimes when I'm teaching something that is physical, like if I'm teaching a new technician restraint, fear-free restraint, sometimes I can't explain, like I have to actually restrain the animal to see like
Yeah.
what I would do, because it's just so much. Like, I've been doing this a long time and I
Yeah.
made a lot of mistakes. So I kind of have a feeling. So yes, it is a feeling. And also it's with behavior problems, you know what? It's probably true of an animal's response to almost anything, but I can tell you for sure with behavior disorders, there's that base coping tool. So there's extrinsic and intrinsic factors. One of the intrinsic factors is coping. How do we cope? I cope in a certain way. You cope in a certain way. Animals have intrinsic coping mechanisms, and bull terriers are intense. They are not, they are intense about everything. Wagging their tail, loving you, chasing a bunny, it's intensity.
Yeah.
And that comes out in their behavior. What I see often in shepherds, and I wouldn't say 100%, is that I can find a trigger. They just, they get frustrated and then I see them start to spin. I
Mm.
don't see that as much in bull terriers, but it might be because they're coming to me so late in the game, or because
Mm.
they are so intense. It's hard to distinguish. Is there a trigger for that behavior, or is
Yeah.
that intrinsic to the animal?
So are you saying like the delta between a bull terrier's baseline and then the end response is smaller because they're so intense all the time? So it's
Yeah.
harder to see that difference.
Yes. So I'm
Okay.
a type A like this, and people tell me, they tell me, Lisa, relax. And I'm like, I am relaxed. This is relaxed, right? So I'm
Right.
always at a certain level of
Right.
intensity. That's how I think of a bull terrier. Yeah.
Gotcha. Gotcha. All right. So bottom line is canine autism might be a thing. And all of the things that people would typically that you hear, you know, and I'm not going to mention them specifically. I don't know if YouTube likes it when you talk about that sort of stuff, to be honest with you.
Well,
Yeah.
now I want to know what it is. I don't
Well,
know.
just like when people, I'll just say it, whatever. When people talk about like vaccine induced autism and stuff like
Oh,
that, that sort of stuff.
yeah.
I think that is where the big step is, because it's like, okay, well, yes, dogs might have their version of autism, but now we have to also circle back and say, okay, wait, like the vaccines aren't doing this, and we also don't even know whatever this is yet. So we have to kind of stop before we. Basically, what I'm trying to say is that it's easy to get out over your skis with this sort of like new information that you're trying to present to people. Um, and I honestly, I just wanted to ask a behaviorist about dog autism and just see, if it was a thing. And apparently it is. So I'm glad people, and I know that now. Um, I think that is about as much as I was looking to cover. Is there anything else that you wanted to touch on during this discussion?
No, I think
Okay.
this was great. Yeah.
Okay.
Fantastic.
Yeah, I'd enjoyed it too. And I would hope that maybe we can do this like once a year or something like that. Maybe once every 6 months. I don't know. Um, would you like to plug your social media or your practice or anything of that nature before we go?
Yeah. So people can find us at Dr. Lisa Radosta. That's on YouTube, Instagram, and Facebook. And they can find out more about me at drlisaradosta.com. They can go to flvetbehavior.com. So Florida Veterinary Behavior Service,
Yep.
to find out more about our service. But that's also on our website, the flvetbehavior.com website is where we have all the articles.
Okay.
So I have tons of articles and videos for any pet parent anywhere in the world to be able to access to help their pets. So then if they can't get to a vet behaviorist, they can get help.
Great. And I'll put the links to everything in the description for your socials and your website. And last question, can people contact your clinic directly to schedule consultations like on their own pet? They don't need their primary vet referral or anything like that?
Nope, they can come
Okay.
directly to us, and
That's really
also
nice.
vet to vet telehealth consults. So if they're somewhere in North Dakota or wherever where there's no vet behaviorist, they can always ask their vet if their vet wants to do a telehealth consult.
Very good. All right, everybody. It's going to be the end of the video for today. If you liked what you see, please hit the like and subscribe button, leave a comment below. If you want me and Dr. Radosta to talk about anything specifically in the future, please leave a comment below, email me, DM me, or her, whichever you want to do. Help grow the channel. And the bigger the channel gets, the bigger and better and more frequent these videos can get too. So, Dr. Radosta, thank you very much. Appreciate everything.
Thank you.
All right. Bye, everybody.